Hi everyone, I'm Dr. Patrone from Long Branch Animal Hospital. I'm just here today talking about allergies, mostly in dogs, but cats too. I would say right now, at least half of the patients we're seeing are coming in for allergies, and it can be kind of a frustrating, chronic issue that a lot of clients have to deal with. So we want to talk about some of the types of allergies, things that your dog or cat could be allergic to, how we treat them or how we diagnose them, and kind of go from there. So let's see. The main things that our dogs and cats can be allergic to are fleas, would be the number one, right? So you don't want to miss a flea allergy in your dog or cat because it's one of the simplest things to solve and prevent, but also one of the things that they can have the worst reaction to. And most people think that they have to have a flea infestation in order for your pet to have an allergy to fleas, and that's not the case. There are fleas outside on the squirrels, on the raccoons, skunks, stray cats, other animals. And your dog goes outside, there could be a flea in the grass, they react to it, they kind of blow up. Usually when they have a flea allergy, it's pretty profound. And so I always tell people your dogs and cats all year round should be on a good flea and tick preventative. Some people think that, oh, well, it's winter time or it's fall or it's spring. You know, I really only need that in the summer. You need it all year. This winter, it was very mild. If it's not below freezing, we still have fleas and ticks. So they transmit other diseases, but specifically with allergies, fleas are a problem. So I guess I'll start with cats. My favorite product for cats is Revolution. It prevents fleas and kills them, and also heartworm disease and intestinal parasites. We also have Bravecto Plus for cats. That's also a good option. These are topicals. There are some orals for cats, like Credelio for cats. But I find that cats are a little bit more difficult to give an oral medication to. So on the dog side, we have so many options. We have Bravecto. This is probably my favorite, what I give my dog, just because the chew lasts 3 months, so I like that convenience. I also use the Seresto collar with him because we do a lot of hiking. He's a 6-pound Maltese, but he's very active. So this collar I like because it lasts 8 months. They can swim, they can get a bath. It repels and kills, which is important for the fleas and ticks. Another oral we like is Credelio. This chew you give every month. Some people like to do something every month. It's hard for them to remember every 8 months or every 3 months, but there are a lot of products out there. For dogs, Vectra is another good one if you're looking for repellent. The orals will only kill the fleas or ticks when they get on the animal. They do not repel them. So you need something like Seresto or Vectra to repel. Everyone loves Frontline. Frontline is a fine product, but we see a lot of resistance to fleas. A lot of pets that come in with flea infestations, their owners are using Frontline. So I try to steer my clients away from those. You absolutely don't want to use dog products on cats. I've had owners get like a 50-pound dog dose and divide it amongst, a bunch of cats, and that can be very dangerous for the cats. So do not do that. All right. So fleas, if you have your pet on a good monthly flea preventative, a flea allergy should not be an issue. So then it brings us to the environment. There's a million things in the environment. So the first thing your vet is probably going to ask you is if your pet's allergy is seasonal. If it's seasonal, then that kind of helps us narrow it down what the allergens could be, right? So if it's the worst in the fall or it's worse in the spring or the summer, there's different allergens at those times. If your animal is worse in the winter, that kind of clues us in that maybe they're allergic to dust mites or something, because most of the plants are not as, active in the winter time. That being said, they can be allergic to almost anything. Human dander, dust mites, fleas, plants, grasses, all kinds of stuff. If there's no seasonal component, then it's something that's around all the time. So a lot of my clients, I would say most people come in convinced the dog is allergic to the food. About 10% of allergic dogs are allergic to food. And that is usually not a seasonal allergy. Typically the diet stays the same all year round. So if your animal's having a seasonal component or seasonal allergy, there may be a small food component to it. So that might be playing a role, but the bigger role is likely something that is changing with the seasons, and the diet is usually not changing with the seasons. But that brings us to our third thing, and that is food allergy. So of the 10% of allergic dogs that have a food allergy, the 3 most common food proteins that they're allergic to are beef, chicken, and dairy. There are some animals that are allergic to grains. It's not the majority. The only way to definitively test for food allergy is with a food elimination diet. So you have to feed a particular diet, not just your commercial Pro Plan or Science diet. It has to either be a prescription hydrolyzed protein food, or if you're home cooking for the dog with very specific ingredients, and you have to feed that diet for 6 to 8 weeks to be able to determine if there's a food allergy. Then you have to slowly reintroduce one allergen at a time to see if the dog reacts. Most of the time, if we get resolution of the clinical signs, the owners do not want to add things back in to figure out what exactly they're allergic to. They're just happy enough to feed whatever that limited diet is. So typically, I recommend using a diet like Royal Canin Ultimino or Purina Elemental. I only had the cat version of ZD, but this is an example of a hydrolyzed protein food. Typically with Elemental or Ultimino, you only have to feed those diets for 2 weeks to know if there's a food component. So my little dog definitely has a food component. I put him on Ultimino, and within 3 days, he was not continuously licking his paws to the point that they were soaking wet and red all the time. So I would say licking of the paws or chewing of the paws is a #1 sign we see with dogs with allergies. So that's something to look out for. Chronic ear infections. If your dog keeps getting ear infections, there's likely an allergy there that needs to be worked up. So that being said, we have a lot of products here that we can help manage allergies. Allergies never go away. You cannot cure an allergy. I hear it every day. Oh, my dog, yeah, the medication worked, but once I stopped it, it doesn't work anymore. And that is correct. You have to be on the medication for it to work, and allergies never go away. You cannot cure them. You can only manage them. So the 2 main medications I use to manage allergies are Apoquel. This is a tablet, and a specific immune medication that just targets the anti-itch pathway. The other one I use is a biologic injection called Cytopoint. And this one is an injection that your vet will give every 4 to 6 weeks. Some dogs do get to 8 weeks, but I would say the majority are on a 4 to 6 week schedule. With that, I would say both are very safe medications. Cytopoint is so safe it can be even used with patients on chemotherapy. So those are good options for managing the allergy. Again, it's not going to cure it. When you're not using it, it's not going to work. So sometimes people get frustrated with that, so it's just important to manage the expectation. One option is allergy testing. So we can test your dog for allergies for the environment, and then you can have, we have a company that will make either oral drops or injections, so it's just like in people, we hyposensitize them. So that is a long road. I would tell you that most pets take anywhere from 6 to 18 months to have resolution of their allergy signs with those drops, but then they're not on medications, forever. So if your animal's only having allergies, in one season, it may be worth it to just manage it with medication. If they're having it all year round, it's probably more cost effective and better for the pet to allergy test and manage it that way. If it's a food allergen, you can just feed the right diet to them and that'll take care of it. For some pets, Apoquel and Cytopoint are not enough, and we actually have to use stronger immune modulating medications like cyclosporine. So there are a lot of options. You should talk to your vet about them, but I think the take home would be that don't expect it to go away. You have to manage it all the time. And it's going to take a lot of follow-up with your veterinarian. So it's not that they, are having trouble solving the problem. It's just something that has to be managed, and you have to work up your pet to see which of these things it is. And you can't piecemeal it. You really do have to first have them on a flea preventative. You do have to do the food trial if you want to eliminate food, and then you have to try some sort of management. Most of these animals, when they have allergies, they'll have a secondary infection, an ear infection, a skin infection, so they're going to need antibiotics or topical therapy. We don't like to use steroids. Steroids are great at reducing inflammation and stopping the itch, but they have a lot of side effects. Not a good option long term. There used to be years ago that was all we had as an option, but now we have much better options. The other thing sometimes people don't use enough, I feel, are topical therapies. Washing the allergen off your dog. If there's pollen, that they're allergic to and it's all over their feet, washing their feet really helps. So using wipes every time they go outside, and medicating shampoos, things like this that have like an antifungal and antimicrobial properties to help them from getting an infection. We have medicated mousses. Again, this is all stuff your veterinarian will talk to you about, and ear cleaning. So there's a lot of maintenance. Fish oil. If your pet has allergies, it should be on fish oil. That really improves the skin barrier so that allergens can't get in. and cause an issue. So it really is a multimodal approach. There's not going to be one thing that is going to control the allergies. You can use antihistamines like Benadryl, Zyrtec, Claritin, as long as they don't have the decongestant, but I would say very few animals have a good response. They're better in conjunction with other things, but alone, very few dogs get relief from just an antihistamine. So if you have any questions, we're always here at Long Branch Animal Hospital to answer them, and all your veterinarians out there will be more than happy to talk to you about allergies, as this time of year, we're having this conversation multiple times a day. All right, well, good luck out there.